Hi there. I'm going to show you a quick demo today on what we're doing in our office with PS Suite during the COVID vaccination clinics and what we're actually putting in patient charts. Obviously, a lot of the training you're receiving is around COVAX and that process, but we want to show you what we're doing within our EMR. So one thing that we've found useful is to create a stamp. So I'll show you this here. So settings, edit stamps. And we've got one in here called COVID AZ given. And you can see the text here. So we've created what's called a custom vital. So we've called it at COVID hyphen AstraZeneca and then colon given. And here, as part of the stamp, we've included risks and benefits of COVID-19 AstraZeneca vaccine discussed as per Ministry of Health vaccine information sheet. And patient has read and understands the immunization prepackage, including the following documents. So the reason we've put this into their chart is that we wanted a medical legal trail in our own system parallel to COVAX so that we would have this, regardless of what happens with the COVAX system over the next number of years, we wanted this for our own protection as well. Okay, so we've included the risks and benefits, and we've included this little custom vital. And the reason this custom vital is particularly useful is that with any custom vital, we can use this to track who we've given this dose to. So again, when I'm in a chart, I'll give you an example here. So we're going to get out of here. You create a note and start typing COVID AZ and then Command I, and then the stamp populates in there. Okay, so nice and simple. And then you would do the Command J. You would enter AstraZeneca, AstraZ, enter. And then you would put in the site, lot, and expiry date, and you would perform the immunization. So those are the only two steps that we're doing during the patient visit. Now, how do we use that custom vital? So what we do is we have a search. So settings, edit searches. And this one's called COVID AZ done. So what we've done here is we've got a search. So again, I'll show you the logic for each of these. So just double click here. So vitals, specify text vital, and then we put the name of the vital. Okay, no @ sign here. Okay, just the name of the vital. Number of times done is greater than 0. So you're looking for anyone who's been administered that AstraZeneca here in our office that we put the custom vital in. And then here, the second one, it's going to say vitals, specify text vital, date of latest is, and then you click ask when run. Okay, when you click it, when you're creating this, it'll say what date. So you'll put the text in here that you want it to prompt you with. Because then when you run your search, and they need to be connected by an and, you're going to perform the search. Going to include your own patients. And when you search it, you're going to put the date. So you put the date of your clinic. So April 19th, 2021. And what's going to come up here is a list of all of your patients who had that custom vital and put in on that date, which is quite helpful for billing purposes, especially if we're doing batch billing, which I'll do a session on later on. But you'll create a search of all of those patients who were vaccinated on that day. Your patients who were vaccinated on that day, and then from that search you can actually batch bill all of those. Or you may want to find 4 months from now who was vaccinated on April 19th to be done 4 months later. So that custom vital will be quite powerful. And the reason that custom vital is helpful compared to why don't we just search for the AstraZeneca, if they've received an AstraZeneca elsewhere and you've entered the AstraZeneca as an immunization, you want to be able to distinguish those versus the ones that you actually gave for the purposes of follow-up, which is why the custom vital is important. Okay, so again, a couple quick tips there for Telus on how to use your EMR effectively during your COVID-19 vaccine clinics. Have a great day.